Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning, everyone, and welcome to today's professional. Today, we're talking about Lima, New Bremen, and Spencerville Dental Associates. And with us in the studio is Dr. Stephen Wojdyla. Good morning, Doctor.
Morning, George.
I understand you would like to discuss the effects of tooth loss?
Yes. Many of us have a tooth that we've lost, and we're still functioning okay in terms of being able to eat. If it's not a front tooth, it's not a cosmetic issue. So we get complacent and think, well, I'm missing a tooth, so what? I don't want to bother to have it replaced. However, over the long term, you have some very detrimental effects that can occur by not replacing a tooth. So for example, if I'm missing a tooth in my back molar, well, I'm losing biting power. So now I'm putting a lot of pressure on the other side of my teeth. Now those teeth start having problems and start splitting apart because they're taking on more force. Another example would be if I'm missing a lower tooth here, the tooth above is going to drift down into that place. Now that tooth is compromised, and now I'm losing another tooth. So there's a lot of domino type of effects by having one tooth that's missing.
How can tooth loss be prevented?
Well, the best way to prevent...
Or actually bone loss, I should say.
The best way bone loss can be prevented, because when you lose a tooth, some bone is going to be lost around that area. The best way to maintain bone is to place a dental implant.
There's several other possibilities, too.
There are other possibilities to replace a tooth. If you're missing one tooth, you can have a bridge done. A bridge is where a crown is placed on the tooth in front of the missing space and in back of the missing space. There's an artificial tooth welded in between that's covered with porcelain. And that's been kind of a traditional way of replacing one tooth. But you still lose bone support in that area over time. By placing a dental implant, the bone stays around the implant and doesn't resorb, and so you have a benefit of not losing bone support.
Okay, so what we're saying is the only thing that will address bone loss is a dental implant.
Correct. That is the only method we have today to maintain bone support.
Okay. Any final words to encourage the people out there?
Just keep smiling, sharing, and caring.